Mumps are contagious viral infection that targets your salivary glands, specifically the parotid gland near the ear, and could be transferred through coughing, sneezing, or indirect contact with an infected surface. Did you know that annually, the mumps virus infects 3,000 people in the United States? Among them, children and youngsters are most susceptible. Identifying mumps symptoms is important, as timely recognition can reduce its complicated stage, which could include meningitis or even hearing loss. Besides mumps symptoms, some people even become unable to eat because of severe pain in their mouths and swallowing of the salivary gland. Let's jump into this video to uncover the top 5 mumps symptoms, which you should never ignore, as well as preventive measures. By adopting them, you can get rid of this disease. Watch until the end to acknowledge and save yourself from direct contact with an infected person's saliva and mucus. Let's begin with number 1, swollen salivary gland. The foremost symptom of mumps is the swelling of the salivary gland. The Centers for Disease Control and Prevention's report indicates that this symptom occurs in 30 to 40% of cases. The salivary gland produces saliva, which is responsible for wetting the mouth. Swallowing of parotid glands that are near the ears can affect submandibular and sublingual glands, as these affected glands can cause puffiness on both sides of the face and appear hamster-like. Ultimately, they could lead to pain whenever you chew food or even drink water. 7 to 10 days, the swallowing of your salivary gland can last. This symptom is a clear identity of mumps and allows them to seek medical attention. Number 2, fever. The next most common symptom of mumps is fever, in which your body's immune system becomes weak, and it raises the body's temperature, which could reach 101 degrees Fahrenheit. This could last for days and be accompanied by other flu-like symptoms, like headache, chills, and body aches. Though fever can stem from various infections or illnesses, mumps fever appears to have other distinctive symptoms, and it's higher than the fever of the common cold or other infections. Monitor your fever instantly before leading to severe issues like mumps, meningitis, or encephalitis, which affect your brain and nervous system. If your or your loved one's fever does not subside with normal treatment, it's time to consult with professional healthcare immediately. Number 3, headache and muscle aches. Waking up with a severe headache and every muscle in my body is aching. It's a concern with mumps. The headache and muscle stretching accompany the mumps infection. These symptoms could range from mild discomfort to severe pain, which can affect your daily activities. Continuous headache can throb with every moment, and muscle aches or myalgia can spread discomfort to different parts of the body. Managing these symptoms requires rest, hydration, and a doctor's medication. But that's not enough. Sometimes you experience a severe headache with muscle pain. Don't ignore it. It's crucial to seek medical attention at that symptom. Your body tells you it needs help. Number 4, loss of appetite. Mumps. An infection occurs when you cannot eat well. Each bite is like a hammer in your mouth. This discomfort of swollen salivary glands, fever, and malaise could cause a loss of appetite as eating becomes unpleasant. This lack of desire to eat can lead to weight loss and nutritional deficiencies, which could relate to other diseases, but it's most common in mumps. The body, which was already fighting the virus, now has to struggle without proper nutrition and hydration, which would worsen the overall health of the affected person. So maintain your nutrients, even when you don't feel like eating. Consider taking soft, easy-to-swallow foods, and stay hydrated with fluids rather than water as well. Number 5, fatigue and weakness. A symptom of mumps is when you are too tired, as if someone is pushing you down by an invisible force. The body's efforts to fight the mumps virus could lead to significant fatigue. It would leave you lethargic and drained. It could persist for several days and even be retained after healing from swelling and fever. Chronic fatigue related to mumps can interfere with quality of life too. It's a time when you should listen to your body and prioritize rest. Ensure to get proper sleep as it gives a sense of healing from weakness. To get a full, swift recovery from mumps, you should take care of your overall health. Although recognizing the symptoms is essential, if you want to combat mumps in the best way, then follow the 5 preventive measures, like getting a vaccination, practicing good hygiene, avoiding contact with infected persons, trying to cover your mouth and nose, and staying at home if you get that. Measles, mumps, and rubella, known as the MMR vaccine, is the best option to prevent mumps. It is administered in 2 doses, first in 12 to 15 months and second in 4 to 6 years. It provides lasting immunity in the body against mumps. There is no doubt that hygiene is necessary to remain healthy, as good hygiene is the foundation of good health. To avoid spreading mumps, it's crucial to practice good hygiene. You can do regular hand washing, especially after coughing or sneezing. Avoid touching the unwashed hands to the mouth. Hand sanitizer is the best way to remove germs from hands. It's a simple way, but it's very effective. We know mumps is contagious, so you have to avoid direct contact with affected persons. It spreads through respiratory droplets, and if you or someone else is exhibiting mumps, that specific person needs to isolate himself. The next important prevention is to cover your mouth while sneezing or coughing. You can use tissues or make a mask to cover your mouth, but avoid covering your mouth with coughs. It could spread the virus more. If you or your loved ones have mumps, it is ethically and medically suggested to stay at home. Avoid going to crowded places, markets, or other busy public places. Save your neighbors to save yourself. A common thing that arises in everyone's mind is when to visit a doctor. When you feel the following signs, you should immediately visit your healthcare provider. Severe headache or stiff neck, which could indicate meningitis. Severe abdominal pain, which might suggest pancreatitis. Testicular pain or swelling, a sign of orchitis. Persistent high fever that does not respond to medication. Difficulty breathing or chest pain. Early intervention can help manage symptoms and prevent severe complications. When we talk about managing mumps, we know its treatment strategies are as crucial as its prevention. Though we know there are no specific antiviral treatments exhibits, but you can treat your mumps. Rest and hydration. The body needs proper time to fight off viruses. Therefore, you should get proper rest. Drinking plenty of water can prevent dehydration, especially when you have a fever. Warm or cold compresses. You can apply warm or cold compresses to your swollen glands, which would relieve your pain and discomfort. Warm compresses can soothe aches, and cold compresses reduce swelling. Consume a balanced diet. During mumps infection, one must take a balanced diet that should include soft, easy-to-swallow foods. These will not produce pain during chewing. Avoid acidic foods, which can irritate your swollen glands. Though people come out of mumps by following preventive measures or by getting proper treatment and changing lifestyle, if not treated in a timely manner, then what could happen? Males can get a condition known as orchitis, in which inflammation occurs on one or both testicles, which could happen in postpubertal males. These affected testicles swell up and cause severe pain. In females, mumps can cause infection of the ovaries, which is known as oophorytes, or inflammation of the breast tissues. These are less common and could lead to abdominal pain or tenderness in the ovaries. This complication could be resolved without affecting fertility. Mumps can lead to several neurological issues, such as inflammation in the membranes of the brain or spinal cord, which is known as meningitis. In rare cases, mumps could lead to hearing loss due to inflammation in the cochlea. It usually affects one ear and could be permanent or temporary. Awareness of these complications is crucial to understand the importance of prevention and early treatment. We hope you found this video informative. If you did, please hit the like button and subscribe to our channel for more health-related content. Stay healthy and take care.